Wonderful. Thank you, Kelly. Thank you, Naomi. Can you see the screen? Wonderful. Thank you very much. And thank you very much, our participants, our group. We have about 1 hour, 45 minutes of speaking, then we can take questions. But many of you maybe who've been on my sessions, I like to interact with you as I go along. I think 1 hour, 45 minutes talking by myself could be too much. So I am going to encourage you, please, to get engaged via the chat. I will pause at some moments and ask Kelly and Naomi just to read some of your comments, some of your questions as we go right along. So again, welcome to Mental Illness, Prisms of Stigma, and Historical Adversity. I just want to start off by reading this for you as our icebreaker, so to speak, as we venture into today's program. Despite progress in recent years, there's still a significant stigma associated with mental health concerns. In the Black community, there's often difficulty acknowledging psychological difficulties, but useful strategies, including religious coping methods such as pastoral guidance and prayer, often are the most preferred coping mechanisms. Destigmatization mental health can be achieved by helping people, especially in the Black community, to understand that mental health is an essential part of well-being, just like a healthy diet, sleep, and exercise. These ideas often lead people to believe that a mental health condition is a personal weakness due to negative stereotypes of instability and attitudes of rejection. Because of this lack of information about mental health issues in the Black community, it is not always clear when one may need or whether or where to find the information. So let's get started under that premise. So for today's objectives, we are going to build some ground by just bringing you some awareness around this challenge of mental health in the Black community specifically. And then after we've read that out, we'll talk about the causes and stressors of mental health in the first place. And finally, number 3, we're going to discuss some strategies or solutions that can help us solve the stigma from a systemic perspective. Because this actually, from our understanding, is that it is a problem that is systemic, but then that has different nuances that shows up in different ways and means. Research indicates that Black communities, including children and teens, is 20% more likely to experience serious mental health problems, with an increased risk of sociocultural factors that relate to mental health. Endeavors to combat racial and social injustice will remain incomplete unless the community's mental health outlook is also addressed. So we are having a race summit today. So the question of race or even racism is not fully addressed if we don't address the mental health aspect in our communities. So let's just dive into the awareness and the unique challenges that we face. I'm just going to share some facts with you. And as you see these facts, you can feel free to say some things in the chat. I'll again check with Kelly and with Naomi to see some of your feedback or some of your engagement in the chat. So let's just build the foundation to our presentation or to our session today. The Black community suffers from an increased rate of mental health concerns, including anxiety and depression. So just to bring around some awareness there, these are some facts. And you will see that at the bottom, I actually show you where the source of this information is coming from. Poverty levels affect mental health status. African Americans living below the poverty level are twice as likely to report psychological distress. So in other words, there is a correlationship between poverty levels and mental health. In 2017, suicide was the second leading cause of death for African Americans ages 15 to 24. And that number is increasing by day. And that should be a concern for us. The death rate from the suicide for African American men was more than 4 times greater than for African American women in 2017. So you can see that our men, the African American men, suffer more. And as a result, their rate of suicide is greater than that of their women, of African Americans. However, the overall suicide rate of African Americans is 60% lower than that of the non-Hispanic white population. So though we are scoring lower here as African American or the people in the minority, we're still concerned that the rate is increasing at an alarming rate, especially when it comes to the ages between 15 and 24 as of today. African American females, grades 9 to 12, were 70% more likely to attempt suicide in 2017 as compared to non-Hispanic white families of the same age. Again, it repeats and reinforces that, yeah, historically, we have not been scoring high in terms of the rate. The risk was not so high in terms of suicide, but we're getting there. And that should be an alarm for us. A report from the US Surgeon General found that between 1980 and 1995, the suicide rate among African Americans ages 10 to 14 increased 233% as compared to 120% of non-Hispanic whites. Approximately 11% of African Americans are not covered by health insurance compared with 7% of non-Hispanic whites. So again, here, we are not insured, we are not covered, as well as our counterparts. Death rate for African Americans is higher than whites for diseases such as heart, stroke, cancer, asthma, influenza, pneumonia, diabetes, HIV and AIDS, and homicide. So we tend to be prone to these diseases more than other races. Rates of mental illness in African Americans are similar with those of the general population. However, disparities exist in regard to mental health care services. African Americans often receive poorer quality of care and lack of access to cultural competent care. Only 1 in 3 African Americans who need mental health care receives it. And finally, the 2 points. Compared with non-Hispanic whites, African Americans with any mental illness have lower rates of mental health service use, including prescriptions, medications, and outpatient services, but higher use of inpatient services. So in other words, we don't really take the holistic, we take the inpatient, the outpatient route more than the inpatient. Compared with whites, African Americans are less likely to receive guideline consistent care. Again, it's important for us to emphasize guideline consistent care, less frequently included in research, more likely to use emergency rooms or primary care rather than mental health specialists. So we can see where we tend to have more access. So compared with whites, African Americans don't receive guidelines in a consistent manner. Even in our research, we are not really included, and we're going to talk about that a little bit more. And we tend to use emergency rooms or primary care, but we tend not to use, or maybe we don't have the access for mental health specialists. Okay. So just building that foundation and that paradigm and that foundation for us to see the landscape of mental health. Because all these aspects that we've touched on all set the trajectory of mental health in the African American society. In the chat, I'd like you, please, just to say what your thinking is. How do you see this playing out in influencing the paradigm of mental health illness in the African American society? I'll wait for your input. Naomi and Kelly, you can help me read what's in the chat if you see them coming in.
Okay, Dr. Ritz, I will take a look at that.
Sure, thank you.
Okay.
If we don't have, not a problem, we can move forward.
We do have one. We have a comment with the significant disparities African Americans face with regards to social detriments of health, you would expect to see mental health diagnosis as much greater rates in Black community, yet you mentioned rates of mental illness for Blacks are comparable to whites. The main disparities seem to be around access to care and quality of care received. What are your thoughts about this, about why this is?
Yes, and we are going to we're going to talk about it in the rest of the body of the presentation. So great question. So please pause it. You will see that right now I was just highlighting the high levels of information of what's coming through, but then I'm going to trickle it down to answer your question specifically as well. Thank you. So we wouldn't talk about mental health and its stigma without looking at the causes and the stressors. That's our second part. So we've talked about the awareness. Now we kind of like understand what the landscape is. Now let's build on and understand the causes and some of the stressors that, that bear the stigma or the mental illness, so to speak. Before I jump into that, I wanted to share this information with you so that you can understand the influence. So African Americans are overrepresented in what they call the high-risk populations. So these are, this is like a group that is often impacted by specific negative occurrences. So by default, we tend to be prone to very high risk populations, all right? So let's think about it a little bit. African Americans make 13% of the population of the American population, all right? And then we go up, 34% of the population male, African American males in our prisons. So that could be state, that could be federal. African American men are 34% of that. So you can imagine the impact of that in our families, in the society, you can look at how unemployment could be a part of that. You can see how insurance can be affected by that. You can see how the family structure can be affected by that, and then hence the result of mental illness. 40% are homeless, all right? So African Americans tend to be more homeless than other races. So again, it affects us, all right, as a result of how we run our homes, how we perceived at work. And then 45% of our children are in the foster care system. And then there's an alarming rate, as I said, of our teens and adolescents that are going through mental health challenges. Research shows that exposure to violence, incarceration, and involvement in the foster care system can increase the chances of developing a mental health illness. So I'm going to jump in now to the chat box. I would like to hear some of your thoughts. What are the causes and stressors of mental health in the Black community? In your mind, what have you experienced? What are your thoughts in your research, in your reading about mental health? What are some of the causes and stresses of mental health, specifically in the Black community?
Dr. Ritz, we have a question from
Yes.
from an attendee.
Mhm.
She says, these stats are very concerning. At what age should we start talking to our children about their mental health?
My suggestion is early as possible. I have a 15-year-old right now who has just come out in my family, and we've just discovered that she's been carrying this since 11 years, but it was unforeseen. So later on, we're going to talk about the signs of mental health issues. When you see that your children are withdrawing, behavior is beginning to change, or when you're watching television and your children are beginning to make some statements about mental health, it's time to jump in. So as soon as you see maybe some changes, are they watching news? What are they bringing in from school? What are they realizing in school? What's becoming aware? For me, 11 years, and I say that from a personal perspective, because when I went to talk to my niece about this, we discovered that she'd been carrying it for 11 years, but we missed it. So as soon as possible. So what are some of the causes? Before I give you some of my research and some of the things that I found out, even in my own experience. What are some of the causes of mental health in the Black community? I'm going to give it about 30 seconds so that we can give people time to type in their chats or their feedback. If not, then we'll move on.
Dr. Ritz, I'm seeing comments of wage disparities, family cultures, economic, financial issues,
Yes,
not enough resources, oppression,
yes.
fear of authority.
Mhm.
One attendee says, in the African American culture, it could be looked down on by others for seeking assistance from a psychologist or psychiatrist.
Sure.
Another thought is lack of feeling safe or accepted in our neighborhoods.
Mhm. Great, great, great. I love that. Thank you very much. Thank you very much, participants, for being a part of this. And you're building on what you've just said, everybody, is exactly what I have in the next slide. What I have just done in this next slide is to organize it into 5 or 6 areas specifically. So let's just dive in a little bit. And I attended Tim Wise's session in the morning. So I will not sit a lot on the stuff that he has talked about as well. And I also sat on, I think it's Janet Elliott's session. I kind of like got some of it. So she also touched on some of it. So I will not go into that. But here are some of the ideas and some of the reasons, the causes, okay? So the first cause is what I call the historical context. And the historical context, which is really a systems thinking perspective, because everything is connected. We cannot talk about mental illness in isolation to the historical context. But it doesn't mean that the historical context can also be talked about in isolation to the other factors that affect mental illness. So everything is connected. So under the historical context, we don't deny it. Slavery, oppression, colonialism, racism, and segregation played a big part in affecting our mental stability and equilibrium, so to speak. It disturbed us. So we're seeing those repercussions even in the 21st century, so to speak. Again, it's all connected. And because we have slavery, oppression, and colonialism, then obviously it affected the geographical distribution. So definitely that's another attribute to the reasons and the causes of our stresses of mental health. So poor neighborhoods, limited resources, high unemployment rates, homelessness, high crime rates, substance abuse, violence, substandard schools. All these things, all these factors affect our mental health, so to speak. Family structure, another point. We've just talked about it. If 34% of males, African-American males, are in the federal prisons or in the state prisons or jails, surely somebody is losing a father to that, right? So obviously this family structure is being destructed, so to speak. So we have single parent family homes, gaps and limitations in extended family support. So yes, the African American culture embraces support. Our pillars really stands on our aunts and our uncles. But in that, because most of us are stretched, so to speak, there's limitations of resources, there's limitations of support. So let's think about it. How many grandmothers look after their grandchildren? But the grandmothers, they have their own struggles, and now they're looking after 5 other children. Or even in the foster care, you'll see that a lot of the foster cares are really administered or managed by single women. But the single women, although they are supporting the family, the children that they have, right, 4 kids, but they themselves are not having adequate support, so to speak. So that affects their mental health. Then physical health status. We've talked about it. We are more prone to diabetes, heart diseases, prostate cancer, HIV and AIDS, breast cancer, infant mortality. Because, if you look at these illnesses, these are serious illnesses. They need serious medical aid and medical management. They need that. And remember, we've just established that we don't have a lot of income. We don't have disposable income. We've got limited resources. These diseases, if you look at them, there's no way they're challenged. They're stressful in themselves. So automatically we are challenged. Even if you were to take away and remove and just say, okay, fine, slavery, we've taken care of it. Let's assume that now we're living in a perfect world where the repercussions of slavery have been maybe stabilized. All right, we are on an equal footing. Okay, we all hope for that day one day, right? But if you just look at the diseases alone, they are stressors on their own. They are bound to affect our mental stability. Then other factors, work stress. Right now, a lot of us are working from home. All of a sudden, you're dealing with the pandemic. Trauma, all right? Past experiences that we experience as African American, even as people. The things that happened to you, maybe you were abused as a child, as a woman, as a man, you were abused. The trauma that you faced, all these things cause mental health challenges. Drug use, alcohol, heredity. So it can be something because your mom or your dad had anxiety problems. The chances are that maybe you may also inherit that. Family problems are part of it. Domestic abuse. So we know of women who've been abused, right? Impact of wars. So think about our war veterans that have gone, all right? This is not just in isolation to African Americans, but anybody who has faced battle. They bring back home that trauma, that impact. How about just the chemical imbalances? That you are naturally imbalanced, not because of anything, but your chemicals are just not balanced. These are all the causes and the stresses that affect our mental health. So it's a complex matter that, yes, has got foundations in slavery and in oppression. But can you see how it's just progressing over the centuries and over the years, and how prevalent it is even in our workplaces, as work stress, as trauma, as drug abuse, as domestic abuse? It's a complex matter that needs a systemic way of looking at it and solving it. So looking at it in isolation and trying to solve it in isolation will not solve the entire problem. So you and I'm grateful for this opportunity because we're starting to have the discussion. I'll take a moment just to pause to see what's coming in the chat, if anything at all, before we move on.
Dr. Ritz, as of right now, we don't have anything in the chat.
Okay, wonderful. Thank you very much. So what makes mental health more challenging in the Black community, we may ask? I'd love to hear from you. What makes it more challenging? I mean, it's already very, very challenging right now. If you look at that alone, the nuances of it, I don't know what you have faced in your families, in your communities, where it has stemmed from. But you can see that this is a lot. These are a lot of reasons. And in your family, in your workplace, in your community, even ourselves, what we're going through could stem from any of these from the slide. But now I'm asking a very, very particular question, and I'm saying, what makes mental health more challenging in the Black community?
Dr. Ritz, I see several comments from the attendees. One attendee says lack of adequate healthcare services, lack of self-care time, the stigma attached to it. In the Black community, we have ideals of the strong Black woman in the idea that it is a weakness to seek help, fear of being mistreated by the system, the stigma of going to get help.
Yes.
And another attendee says jobs that provide insurance.
Yes. Great.
And
great.
finding a good therapist.
Yes.
There's also a comment that back in the day, the attendee used to hear her grandmother say, and her mother say that we don't go to the therapist, we just pray.
Yes. You're very right. You're very right. Most of those that you have mentioned are all a part of the main challenge, which I put under the stigma. So I think most of you may know that I'm Zimbabwean. We didn't talk about it. We had mental issues in my family, even up to date. I remember we took one of our elderly uncles. Finally, we said, you know what, let's go and get help. And I remember the specialist said, this is so late, where were you? We knew all along, but it was taboo to talk about it. It was taboo to say, hey, we think you need help, because there was bias. The moment you mention that mental health, it's associated with other means. In my country, if you use mental health, even up to now, it was, you are saying that I am quote unquote crazy. So you couldn't say it. You couldn't admit that you need, maybe it was in chemical imbalances. You couldn't say it. So people suffered because of that, because of the stigma attached to it. So you are right. I believe that the biggest challenge, one of the biggest challenges that makes it mental health more challenging in the African American community is the stigma. And it's the elephant in the room that we don't talk about it. You know that Uncle so-and-so needs the help. You know that maybe your mom needs the help, but you can't say it because it's a taboo. So let's dive deeper and unpack this elephant. And I'm grateful for this opportunity. For today, we can start to talk about it, and then we can start to feel a bit of comfort around it, and then take it to our families and to our communities to say, you know what, this mental health illness is just, it needs attention, like cancer needs attention, like HIV needs attention. All right.
Dr. Ritz, there is a question from the chat section from an attendee. They ask, how do we get someone help that clearly needs it but refuses to admit it?
Good question. You can only influence, you can only suggest, because at the end of the day, the person has to realize that they want it. It's also going to be determined by how you're putting it and how you're suggesting and how open they are to your suggestion. You could give them an example of somebody maybe that you know, maybe that they know, that they respect, to say, you know what, they have sought the help. If you truly believe that you need that, we are here to support you. Later on in the session, I am going to provide some questions that you can ask people that can start to open that discussion, so to speak. But at the end of the day, you can only ask, you can try to influence them, you can try and expose them to as much literature as you can about mental health. But if they don't want, you can't force them. You can only keep trying to influence. Great question. So it's an invisible struggle as well. So in addition to the stigma, because now there's a stigma attached to it, a lot of us would rather not make it visible. So listen to this, and I give you the source of this quote and this article. It's a powerful article. If you've got time, please go and read it. Depression has been a constant part of my life since then. A lot of people don't know that. Like most Black people, it's not something I talk about openly with everyone. I'm already Black, a woman, and overweight. Why add another stigmatized identity? Why give people another reason to doubt my capability? Why threaten my professional reputation? Why be vulnerable? As a community, some of us either suffer in silence or keep our mental health issues between us and the Lord. Does that sound familiar? I think it does, because you kind of like just unpacked it when we started this session, this particular section in our presentation. So you can see the struggle here, that I would rather struggle by myself. I'm not going to say it because I'm already struggling. I've already been stigmatized. I'm Black, I'm a woman, I'm overweight. If I tell you that I'm depressed or I'm anxious or I'm really having mental issues, you're going to even isolate me some more. You're going to be segregating me. You're going to be isolating me. So I'm going to suffer alone. And that way, we never talk about it. So it becomes the elephant in the room. So instead, like the other attendee who asked, your behavior then maybe becomes erratic and maybe, you know, it's up and down and people kind of like just know it, but nobody can talk about it. So it becomes an invisible struggle under the disguise of stigma. There is a history of being denigrated or dehumanized and not wanting to have one more thing be wrong. Washington says, mental health doesn't top the priorities list. We don't have time to be sad or depressed because we have too many things we have to deal with right now. Those statements come back from our slavery days, where we had to be hard, where we had to be resilient, where we could not be sad because we needed to survive. And these statements are still prevalent today. So I think you've heard it. Mothers tell their daughters, like, you're going to wipe those tears. What are you crying about? You can't be sad. Straighten up, stand up straight. You're not going to show your feelings at all. All that language actually makes us bottle up our feelings and our struggles, and we don't really share. Again, because we are in the survival mode, so to speak. What is the mindset behind the stigma? So there is a stigma, and you've identified it, you've identified some of it. So we've got these mindsets, and you started giving me earlier on when we talked about, you know, what is the one thing that is really challenging in our community? And here are some mindsets around it, and you've mentioned them already. African Americans don't usually disclose symptoms. So we don't, because again, we don't want one more thing wrong with us. We're going to be labeled. We're going to be, you know, marginalized, so to speak. I will not get that promotion if they discover that I'm seeing a psychologist. They're going to think that, you know what, I'm not stable, all right? Or depression, anxiety, and suicide are taboo in the Black community. I remember growing up in Zimbabwe as a young lady. We used to believe that no, depression belonged to other races, not to us. All right? You're going to see a psychologist for what? We don't talk about that out of lack of knowledge. So these things are real. We are seeing them. And if we are going to do it for anybody, let's do it for our younger generation. As you can see, that 15 to 25 they're in their prime, in their risk. So we have to face this. We do get depression. We do get anxious. We do have suicidal thoughts. And we have to bring them to the table to talk about them. It's not a taboo. And it's not a sign of weakness if we are going through some of these emotions. Then here, our story is of perseverance and resilience. We survived slavery. Surely we can survive sadness and anxiety. So we minimize the illnesses because we believe that we've conquered some things that were bigger, right? So we don't realize that with the mental illness, it's something internal that eats us inside. Though it's not expressed sometimes outwardly, it has to be taken care of because it affects us in the long run, even outwardly, and in our family and in our communities. Then mental illness is a sign of weakness. No, it's not. It's not a sign of weakness. We have to treat it like a sickness, like any other sickness. There's a syndrome that they called the John Henryism, which is really a behavioral disposition. This was an African-American gentleman who got involved in a contest, and he won the contest, and they were running and running and running and running, and he worked hard to persevere and to persevere. So he had the coping mechanism. He persevered through the contest, but then at the end of the contest, although he won it, he died. So they call this the John Henryism behavioral disposition. Most of us cope, right? We become numb to everything that's going on for the sake of surviving. But at the end of that, it's breaking us mentally. And I think some of us can relate because we have to be strong for our children. We have to be strong for our mothers. We have to be strong for our teams, even at work. So you're putting in all these resilience strategies, all these coping systems, but at the end of it, you really are suffering. You're carrying so much that at the end of that road, at the end of that context, it's going to affect you mentally. Any questions before I move on to the next one?
I see one comment that says that we need to start more conversations and offer more help in the local churches.
Yes, you're very right. Later on, we're going to talk about that because that's our go-to as African Americans. It's our churches, it's our religious facilities that we go to, our pastors, our deacons, our rabbis. We go to those places and we find help. And that's good because we are known for that. But there's another layer, the scientific layer. There's another layer, the medical layer. We need to bring that in so that we can actually become holistic in our approach. So just carrying on. So thanks a lot, Naomi. Just to carry on the mindset again, African Americans are more likely than non-Hispanic whites to refuse procedures recommended by their physicians. I'm sure most of you have dived into the history of Martin Luther King. It's known that he had mental illness challenges, but he refused to seek help because again of the stigma. I'm thinking most probably, and this is just my thinking, I'm thinking maybe he thought, wow, I'm a leader. I cannot be seen like that. I'm a man and I'm an African man. I'm supposed to be strong. I cannot. And the stigma that came with that. And remember now in the 1960s, 1950s, that was even more taboo than it is today. Then many African Americans resort to self-medication. So some of us fall into drugs, alcohol, or even isolation. We want to deal with it by ourselves, especially our Black man. We want to be the strong guy. We want to be the strong man. You know, we cannot accept that, you know what, we need help, because in our eyes, it's a sign of weakness, whether it's in our eyes or whether that's society that has imposed that on us. So we need to learn how to unlearn this behavior that has become maybe even second nature to us, because now we just cover it up and we say we are okay. Meanwhile, we are not okay. So the root of the stigma: during slavery, it was believed that slaves were not sophisticated enough to develop depression, anxiety, or other mental health disorders. So this actually talks to our medical facilities right now. The people that we go to seeking help to, sometimes we are misdiagnosed, so to speak, because we are believed not to have depression or anxiety, because again, we were not sophisticated enough, or maybe we were not worthy of that care. All right. So you can see how everything is very complex, to the extent that even the studies that study mental illness, they have not dug deeper into the mental illness for Black Americans or African Americans or other people of color. They're not rich at all in their understanding of our dynamics because of this kind of stigma, that we're not sophisticated enough. Then from these historic misconceptions, African Americans ignore mental health illnesses or call it other terms such as stress or being tired. So I can say I'm stressed, I'm tired, or I'm having a moment, I'm just going through something. We call it everything else, but we do not call it mental health illness. Then stigma tied to African American relationships with the medical industry. I've already touched on to that. It is known that we don't really trust the medical industry, our hospitals, our doctors. We don't, because we believe that they don't really identify with us. They don't really understand us. They misdiagnose us. They assume we are this. Nobody really understands us in some of these institutions. So therefore, we don't trust the medical institution, and therefore we don't seek the help. So you would rather go to your pastor, because you know what? Your pastor is African American and you have an identity with them, versus speaking with another doctor or a medical doctor who is from another race, so to speak. So we don't really trust the institutions themselves. As you can see, this is a lot of information and a lot of facts, a lot of reality. But what we have to do is to dig deeper as a people, as a community, as a race, as a culture. We need to now start to say, hey, we need to unlearn some of this, or even refuse some of these labels. How then do we start to build and to know and to have the conversations, even the difficult conversations, that we say, yes, we do have depression. Yes, we do have anxiety. Yes, we do have real challenges. And it doesn't make us weak. In fact, it makes us strong. If we find the right help in the right means, it will actually make us stronger. To add salt to this stigma, there's an impact to this stigma. With me, I've gone on a very personal quest on this mental illness, because it's touching young people that I work with. It's touching a lot of young people in my family, and I have spoken with them and they have shared some stories with me personally. So this stigma, so let's just read this. If we are unable to remove the negative stigma surrounding mental health in the Black community, we are willingly allowing another generation to grow up without access to counseling and mental health improvement, resources that can help them live a happy and healthy lives. Now we're talking about our generation, our adolescents. We are now adding salt to the injury. So we saw that the generation, we've just talked about Martin Luther King, that was another generation. We're talking about us, the Generation X. We're talking about our Generation Y. And now we've got Generation Z. And then the generation that comes after that, they're going to be impacted. What is it that you and I can do? And I understand that we have some systematic problems that need to be solved at a national level. I understand that. Mental health has to be resolved at a national level. But what you and I can do in the meanwhile, while we're having these bigger issues being taken care of, not that mental health is not a bigger issue. What is it that you and I, as an aunt, as a leader, can do to start dealing with this at a grassroots level, to start impacting your children, like the question that has been asked, Mary, when can I start having this conversation with my children? So this is what's really fueling my passion when I look at this. African American teens face mental health crisis, but are less likely than whites to get treatment. Yet Black youth are less likely to seek treatment. About 9% of them reported an episode of major depression, but less than half of those, about 40%, received treatment. That should be concerning to us mothers, aunts, and grandparents. By comparison, about 46% of white youth who reported an episode were treated of depressive symptoms. So you see, they're higher than us. Instead, some turn to suicide, now the second leading cause of death among Black children ages 10 to 19. The rate is rising faster for them than any other race or ethnic group. Data from the CDC and prevention show that the rate of suicide attempts for Black adolescents has risen from 73% from 73% from 1991 to 2017. I just want you to think about that. And my biggest question is, how can you and I rally around this to not stigmatize this and for us to make it a normal conversation, a normal sickness, illness, so to speak, so that we can impact our next generation, our future leaders. So now we've talked about the elephant in the room, the stigma. We've talked about why we are wired the way that we are, and we've agreed you and I are definitely on the same page. But I'm saying, even if we don't want to do it for ourselves, can we do it for our next generation? So what are the signs of mental illness? How do we know that? Because we are getting to know this, right? We getting to be open about it. As I told you, my niece, when I asked her, I said, how long have you been feeling this? She says, since I was 11, and now she's 15. And all along we thought because she was quieter than the other two siblings, we treated her like the baby. So we just said, you know what? She just doesn't like people. She likes to spend more time by herself. So we just let her be until the alarm went off. Until the alarm, which was a very scary alarm. So how can you tell that maybe there's a mental issue, a mental challenge in my family, in my workplace, in my community? I'm going to share some of them here. So if they're becoming impulsive in the way that they behave, or maybe getting irritated quickly and immediately. And this could be your adolescence, this could be an adult around you. So look at their behaviors. You know your people, you know your children, you know your workmates, you know your leaders, you know the people around you quite well. But if you see an impulsive behavior all of a sudden and signs of irritation, that could be a sign. And then talking about feelings of loneliness or despair, like I'm lonely. And you know what they say? They say they're lonely, yet they have come from a date with their friends. But they'll come back and say, I'm lonely. And especially in this COVID period, parents, aunts, grandfathers, and grandmothers, please watch out for that. These are children. I'm just specifically talking about our teens now, even our college going children. These were people that had a campus, and all of a sudden they've been isolated. You know, gadgets are good, but they're not the same as hanging out with your friends. So please allow them to have those days, obviously with care because we're all quarantined, all right? So I know that as parents, we say, stay quarantined, but their friends bring something else to us. And then even for adults, look for that loneliness. Well, those workmates of yours that are kind of like when you talk to them on that Zoom call, I'm lonely. It looks like, this COVID is not going away. There's no hope, or I've lost my job. I have no reason to leave. Listen for those clues in your communication, in your speeches and dialogue with your colleagues. Excessive worry, that they're worried about certain things over and over, and it's very, very excessive. You can tell that they're very concerned about some things, and it's kind of like making them irritated. They're no longer the same, and I can say their peace has been disturbed, so to speak. And I know that sometimes we're not supposed to be in a peaceful, otherwise, we wouldn't be living a life. But you can almost tell that their peace has been taken, and they're no longer at an equilibrium. They can no longer find their footing, okay? And they're not functioning like their usual selves. So changing habits, and maybe you can see that the way they're dressing right now, you kind of like said, why are you dressing like that? Or general appearance, eating or sleeping habits, So for my niece, she just started sleeping a lot. That was like the wake-up call. Why is she sleeping so much? Why is she sleeping so much? And even eating, maybe the quantities that somebody's now consuming are bigger than normal. Maybe even the kind of food that they're eating now is not as healthy as it used to be. They don't really care if they drink so many sodas in a day, or even eat, like not unhealthy food in a day. It's like, it's just going out of pattern. So watch for those signs and those symptoms. Trouble concentrating. So if you're talking to them, they veer off. They can no longer focus on their job. They're making mistakes. They're repeating themselves. They're saying something that is out of line sometimes, that is not really coherent in their speech, so to speak. And lastly, it could be they've turned to substance abuse, all right, drugs, and other things as well that, that speak to substance abuse. So what are some of the signs have you seen? If I can hear from our attendees and our participants, please. What are some of the signs have you seen, have you experienced, have you read about?
We do have when you find out that a teenager has contemplated suicide before, what should our next steps be?
Our next step, and I'm talking now from experience, firsthand experience. The first thing that we did, we talked to her to find out what was going on. So as parents, we normally believe that we are spending more time with them. We're giving them everything that they want. In their world, they're seeing something totally different. So try and ask them questions to say, what's going on in your world? So in our case, it was like, I feel like I'm not heard. I feel like I'm not understood. We were shocked because we thought we did our best. But then we started asking, what does it mean to be understood from your perspective? Tell us what it means for you in your world. So in a home setting, create a very comfortable place where she can speak or where he can speak. And some of what they're going to say is going to make you feel hurt as a parent, but you can't show that at that point because they're telling you what they're experiencing and what's something that is not working in their world. So that's one place. The next place is let's find you help. Because clearly they want help from a psychologist, from a psychiatrist. So find the best help that you can. It can be volunteer, it can be an organization that volunteers that kind of services. You can actually interview several ones. When you take them through that process, they have to resonate with their counselor. They have to click with that person, so to speak. So allow them to have that external voice that listening ear. But it doesn't mean that when you do that, you wash off your hands. So in our experience, because the mother was very involved, she would follow up with the psychologist or with the psychiatrist, and she wanted to know the appointments. She wanted to know what they talked about, obviously understanding that there are limitations. The counselor was saying, we're very amazed that you're a mother who is involved. Normally mothers come here or fathers come here, they drop off their child and then they go away, they come back, they pick up, and that's it. We never hear from the mother again. So please, when you speak with your child at home, when you finally find that help, make sure that you're still involved. You got to speak with the psychologist privately, understand what's going on. You got to speak with your daughter or your son when they come home to say, how is it going? Remember also, some of it they will not be able to share with you, and that's okay. Give them the time. Okay. Great question. Great question.
Dr. Ritz, we have another question about perhaps some suggestions on good ways to approach the conversation of mental health with parents who may not believe you when you say you're suffering from depression or anxiety.
Mm-hmm. So is that a question or is that a
Yeah, some good ways to approach your parents as a teen or a young adult who probably just doesn't feel the way they think they should.
and that's a great question. I would say get your support. So if you try to speak to your parents, they cannot hear it. And it's a realistic problem because remember, it's still a stigma. So I'm going to suggest that find your coach to come in and help you with that. Find your teacher to come and speak with your parent as well. So who in your society will your parents listen to? So that you can say, hey, I'm really having a problem here and my parents are not listening. All right. Expose them to things like this. You know, mom, there's a conference, a summit that's going on. Would you like to be a part of that? So expose them. Articles that you're reading on, expose them to those things, but also find those supporting structures, your teachers, your coaches that can actually come to your home and say, hey, I got something that I want to talk to you about. So this is one thing that the African-American families have, or the community has. The structures are there. So let's leverage off those structures in terms of communication.
Dr. Ritz, okay. We have another question from an attendee.
Yes.
Does substance abuse mean there is a mental issue, or should you begin to ask a question as to why the person chose to drink or use other substance abuse?
Yeah. Great question. So the reason I had spoken to it in bracket like that is because I was talking to mental issues. But it doesn't mean that because somebody is taking drugs, it's a mental issue. No, it doesn't mean that. It could be because they think it's a recreation, it's a good recreation, and they just love it, right? But it doesn't mean that. So I love the idea of you asking the question, why have you turned into this? What's going on? And most probably the answer will never come, may never come, because remember, there's a stigma attached to it. All you can say is that if there is something else that's going on, the reason you've resorted to go to, drug abuse, if there's something else, I'm here as your friend and I can go and find help with you. So now we've talked about what are the signs. So you've seen the signs. Some people are having trouble concentrating, substance abuse, excessive worry, impulsive behavior. How do you start then? How do you start? I'd love to hear from the participants. For some of you who started the discussion with somebody and how you bridged that, how you closed the gap and where they opened up to you. If you've got a story that you can share with us, we'd love to hear from you.
Dr. Ritz, there's a comment here where somebody's niece, her coach approached the parents, like you mentioned, because they noticed that she had been losing weight and just seemed a bit despondent, and made the parents aware of a potential mental health issue.
Great. And how was that taken? I'd love to hear from that participant. So when the coach approached the parent, was the parent open, or was he resisted, or was she resisted? I'd love to hear.
In this case, the parents were very open to it. And I feel like they may have known, but didn't want to admit it.
Okay,
I think there's some fear involved with admitting to yourself that a loved one is suffering.
Yes.
And you feel, like you said, that you've done everything that you possibly could, but you're not in their shoes. So
you're right.
The admission that there may be a problem, I think coming from a third party just adds credence to your suspicions.
Sure. You're right. Very, very right. Thank you very much, Naomi. Before I go into this, let me tell you, I've just mentioned about my niece who is 15, and this happened recently. So with her, she posted on social media that she was suicidal. Mom didn't know. The next thing, the coach was at the door. The next thing, the police and child services, they all came. Shock. Didn't know that. And then finally they had the discussion, started talking. Mom is beginning to understand. It's not my worldview, it's her worldview. All right. Having the discussion. She's getting counseling, she's getting help. Guess what? A week ago, her own friend, the little girl, has also posted on social media, I want to take my life. So what does she do? Her mother and her, my little niece, they go off to their parents, to this home, and they start talking about it. But again, because the mother of this young lady, this is the first time that she's hearing it, she's saying, what do you mean I don't hear you? Are you saying that we're not spending more time with you? We've just been here. But then, because my sister has just been through the same process, she came in with some words to say, but that's her paradigm. That's how she's feeling. And then the situation calmed down. And I'm now thinking they're on their next stage to find her some help. So great job. Let's rally together, because it's coming in forms and shapes that we've never experienced before. And social media, the demands on social media, the expectations of our children on social media, that alone can really drive our children to suicide. So how do we start the conversation? So these are some of the things that you can say. And these questions are relevant to our teens. They are relevant to our Generation X, to our Generation Y, to our baby boomers, anybody who you're suspecting or has got the symptoms of mental health. So you can say, is there anything you want to get out of your chest? All right. Are you okay? You don't seem like yourself lately. Especially in the COVID period, you will see that people are going up and down. This is where we need to be very emotionally intelligent. We need to use discernment. We need to use wisdom. We need to be alert and just check on our children, our families, to see how they're doing. And we make it a culture of just checking up on each other. And I am going to challenge us today. I know we all love text messages, like, hey, I'm just checking on you. A lot of people can hide behind the text message. They will tell you, I'm okay, I'm good. And meanwhile, they're not. Pick up the phone and speak. And Zoom, this, where you can do teleconferences, say, hey, let's do it via phone, Zoom. So let me see your face. Okay. So make it more tangible, right? Or say things like, seems like something is up. Do you want to talk about what's going on? Or I noticed that you've been down lately. How are you? And we're talking about really sincerely asking people, how are you? Not as a question of just being polite and being respectful. No, really asking with your concern, so that when they say, I'm not okay, you're prepared to probe further to say, what's going on? Do you want to talk about it? You're not doing it as in passing. And then, hey, we haven't talked in a while. How are you? And I'm coming back to your daughters and to your sons. Because we are talking about Generation Z, Generation Y, I'm Generation X, so they're quite far away from me if they're Generation X. So their language and my language are very different. So us as a community, let's work harder to try and understand, their thinking patterns, what drives them, what motivates them, their values, without really imposing our way of doing it. We did it this way. So let's dive in and really understand, what it means to have a friend, what it means not to have a friend, what it means to have the latest hair do and not have the hair do, how it affects them and how it doesn't affect them. Any questions or any input before we move on to the solutions?
I have a couple of comments.
Yes.
One in regard to how do they deal with it, or how do they prompt the discussion. She had a friend called her just to have someone to listen to her and not judge. And she listened, but then suggested a therapist as well as prayer. And luckily, her friend was open to seeing a therapist.
Sure.
Another commenter said that they think it's very important for parents to be emotionally present and to also validate that their children, wherever they are, validate their emotions wherever they are, in whatever mental state, and that it's not, that it's okay not to be okay.
Sure.
The help is available.
Yes. Spot on. Spot on. Thank you, Naomi. So now we've talked about the awareness initially. We've talked about the stigma in part 2. Now let's talk about some of the systematic stigma solutions. How do we move away from the stigma? How can we find systemic solutions to it? Okay, so systemic problems require systemic solutions. How do we overcome? I'm just going to jump right into it. So as I said earlier on, there's a layer to all these things. And I think in the morning, Team Wise did a great job to address it. Jane Elliott did some, and I'm sure you've attended some other great sessions as well that are really talking to the racism part of things. So I'm just going to highlight this as part of it. We are on our way. We are having these discussions already. So let's address these historical disparities: slavery, racism, discrimination, and segregation. We have to address the easyisms, all of that. We have to. That's part of it. It's a given. We have to keep having the conversation. Okay. So racism and our response to it kills us more than anything else, because you can tell most of our challenges are stemming from here. Not that we don't have any other challenges, other external factors that are coming in. I just wanted to highlight that. So as the Black community or minorities, we have to also understand that we have to accept ourselves as a whole person, and the whole person needs care. So you're not just a person who's supposed to be physically strong and provide for your family, but you're a social being, you're a spiritual being, you're an emotional being, you're a mental being. So I think that as a Black community, we are very good about understanding that we're a spiritual being. We go to the Lord, we go to our pastors, to our rabbis, we go, and we go to our spiritual guiders. We go to those places. So I think we're kind of like okay there, to be honest with you. But there's another layer, the social context of it. So we have to make sure that in our social context, we are hanging around positive environments as well, right? Physically, we're eating well, we are exercising, all right? And then mental, which is where I really want to spend on, which is what we're talking about. We gotta be okay just as much as we have to be okay physically, socially, spiritually, and emotionally. So emotionally and mentally, we have to find the help that we need. Those 5 places, those 5 pillars have to be balanced. And I know it's hard work to balance them, but that's what we have to strive for. So if you're feeding your spiritual self, if you're feeding socially and physically, do the same for mentally and emotionally. Our departing point. Number 2, we need to tackle the stigma head on. We have to say mental illness does not discriminate. No matter what age, no matter color, no matter religion, no matter anybody, it is a mental illness that affects everybody, and it affects us as Black people. So as we have to acknowledge that, and we have to be, it doesn't make us weak. We just have to be aware of it and own it and say, yes, we do suffer because we're just like human beings. We are human beings. So let's bring the awareness first. So bring awareness to the use of stigmatizing language around mental illness. So we have to say mental illness is an illness like any other illness. Mental illness deserves attention like any other, right? If you just look at the numbers alone, they will tell you that we need this and we need to accept it. Number 2, let's move on to educate family and friends and colleagues and the unique challenges that mental health actually brings in the Black community. So let's educate our families. Like now today, if you've got family members that were not a part of this discussion, take this information and go and share with it. Share with them the statistics and how it's actually ruining our adolescents, our teenagers, how it's making an impact in our family structures, right? So let's have the discussions and let's educate our family and our communities and our workplaces. And then let's become aware of our own attitude and beliefs to the Black community. I remember as a youngster, as a Black woman, being told that you can go to a mental health facility or mental illness and somebody's going to see a psychiatrist and a psychologist. Initially, I would say, oh no, that was taboo. I remember because I wasn't aware. I wasn't aware of my own biases until I took the journey myself and say, wow, it is actually just like going for your, cancer checkup. All right. It's just as good. It's just as important to do that. So in this conference right now, in this summit right now, check yourself. What have you thought about it? Are you biased about people that say they have the situation? Do you believe that, we don't suffer from that because we are Black people? Can you change your attitude and be open to hearing, to walking a journey with somebody who's gone through this or who's going through this and understand where they're coming from and how it has impacted their lives? And I think most of you will know that. I don't speak against prayer or religious beliefs and guidance. I'm for that. I believe go and find your prayer, go and find your religious guidance, find all those things, but don't let that work in isolation. There's nothing wrong with you seeking medical and scientific. The God you worship and the prayer that you seek can work in divine intervention with medical help. So don't shy away from that. And I remember the comment that was made earlier that I think we need to take this discussion to our churches. Yes, we need to. So that our pastors, our rabbis, and all our spiritual leaders can also start to embrace to say, it doesn't mean that a woman or a man lacks faith if they seek medical help. We mustn't judge them. What we want them to do is to be whole in themselves so that they start to live their life as a person who has been taken care of holistically. This is what we are striving for. Number 3, cultural responsive mental health treatment. This is a disparity The reason why we've also not sought mental health help is because we don't really identify with the institutions or the providers. We don't speak the same language. We don't have the same experiences. Research has not been done on us. So therefore, we don't even go. So the big ask is here. When you are engaging with somebody, it doesn't matter whether they're from another race or from your own race or from your own community or culture, but ask the provider some questions about the treatment approach. And if they provide care that take your culture into consideration. So do they understand the dynamics of where you're coming from? Do they understand that maybe your children are maybe not as open with you as possible? Do they understand that maybe you're rearing a family as a Black, strong woman who's been told that you need to be strong and you cannot show a sign of weakness? Do they understand that and how it's affecting you? And then seek attention from someone who is aware and affirming of your intersecting identities, race, class, and gender, and even your sexuality. So seek attention to that person who understands that, you know what, you're just not, and a quote unquote, a Black person. You're just not a Black male. You're not just a Black female. You're just not a Black adolescent. You bring other nuances that make you a complex human being. Are they willing to unpack that and the complex human being that you are? And secondly, they must realize that you're evolving. The challenges that you faced 10 years ago and the challenges that you're facing today are no longer the same. Are they willing to understand you and to meet you where you are? And also to address any barriers that you may have, any hesitations that you may have. Are they willing to make you feel comfortable and embrace you as a whole person? And then lastly, ensure your provider is culturally responsive and respectful of your needs and how to infuse these beliefs into your treatment. Kelly and Naomi, do you have any questions at this point or any comments?
Yes, Dr. Ritz, there are a couple comments. And this one is very intriguing. Other than educating mental health professionals about mental health for African Americans, what can the field of psychiatry or psychology do to improve mental health for African Americans?
The biggest gap that I feel in my mind, and thanks a lot, Naomi, that's a great question. The biggest question in my mind is the research. Nobody has really done an extensive study on us and mental health. One, because some of our people are in less privileged places, communities, so people don't go there and study. Number two, 34% of our men are incarcerated, so nobody does those studies. All right? Some of our people are homeless, so nobody talks to those people. So what you have most probably are the accessible Black people that can talk to you, but you're not having this full spectrum of the Black culture and its diversity and its complexity. So therefore, the data that you have or the research that you have is skewed to some level. So we have to make sure that the research covers all the nuances of the African American community, so to speak. That's my first place to go to. Do we really understand this culture? Do we understand the people that are homeless? Do we understand the people that are in our prisons and in our jails? Do we understand how it's affecting them? Have we spoken to them? Have we included them into the research? Great. Any other comment? Feedback before we move on?
And one other comment echoing what you have just discussed was that spiritual guidance is important. However, it doesn't negate the need for clinical intervention in some cases. The discussion needs to recognize that both can work simultaneously.
Yes.
Goes back to the holistic approach.
Spot on. I agree. I agree. I agree. Have I heard of people say, you know what, I prayed for my depression, my anxiety, and you know what, I'm fine. It does work, but you're right. We don't want that. That's not a one size fits all for everybody. You know, I could go through that and I could experience it, but it doesn't mean that Naomi is going to experience it. It doesn't mean that Kelly is going to experience it. Kelly will need the combination of the medical intervention and the pastoral intervention, the faith intervention. We need these things together, and we need to start preaching those people. And most importantly, I'm going to repeat this. If you basically believe that you are going to get your healing merely by your faith and trust and prayer and all that, don't judge the people that are doing both. Don't judge them. Don't stigmatize them now and say they don't have faith. No, they need it. What we are trying to get to is a holistic person who is functioning well and who's finding a solution to move forward. So overcoming the stigma. Here again, as I said, we have to secure our future, our next generation. I acknowledge, and we've acknowledged, mental illness is a complex matter. It's not a linear, a cause and effect. No, it's not straightforward. There are so many causes. It's interconnected. I think what's paramount now for us, now that we know that unemployment, family structures, racism and slavery, drug abuse, the side of town that you live in, your community, all of those nuances can affect your mental health. We agree that. My focus here is to say, what is it that you and I can control? What is it that you and I can start to actually influence as we live right now? So I believe the family structure, we can help there. How can we help our single family structures? We all know that. Every study says it. A two-parent home produces better results in terms of rearing our children, right, than a single family. Can we get success in a single parent family home? Yes, we can. But studies show that if it's a two-parent structure, we are likely to be more influential, to be more successful. So my question to you is, as a parent or in the African American community, how can we put family structures that are more resilient, that are forging a new generation that has all the structures that they need to be successful in this world? You will realize that a lot of research, and I can't read you everything that I've been reading. You get to understand that a young man is in high school and is proving to be maybe quite violent and quite irritable, and they think maybe he's just having an attitude. But when they finally sit down with him, he says, it's because my mom has just left us, or my dad has just left us, or because I'm in a foster care home. And in that foster care home, we've been moving and I've been moving and been moving, and I've been separated from my siblings, and I'm being affected. I'm saying, how can we structure these families? How can we bring more concrete families that have the support structures that our generation need, that our wives, that our mothers, that our husbands need? What is it that as a mother, as a father, we can put together before we decide to go our separate ways? How can we work towards building a family structure that is functional for the next generation? Then school and education. So our schools, how can we make the mental health a part of our education? Because if we make it a part of our curriculum, we're educating our children. Our mothers, when they come to schools, our parents, when they see our schools and they see that they're talking about mental health issues, it starts to normalize the discussion. How can our schools even and our education understand the struggle of an African-American daughter, an African-American child, and see the struggles that she has, that she's coming from behind, and she's trying to compete with people that have gone before her already. And I've already talked about the mental health itself. You know, how can we talk about it as a subject matter, as a subject in our curriculum? And how do we put structures in schools that a child who is maybe giving the teacher problems is not isolated, is not labeled a difficult child, but in fact, we want to understand what's going on at home, what's going on in their community. Why are they acting like that? Do we really care to say what's going on? We see that your behavior has changed. Foster care systems and improvements. I admire the ladies, the parents, the families that have the structure in place. They are giving us solutions. But the question that I'm going to leave with you is this sustainable? Is this a result? Is this a good solution? Is this a sustainable solution to help the foster care? It can be interim, but remember, systemic problems require systemic solutions. So I was reading a story that happened in Michigan. They were doing a study about African-American communities, and they were studying homelessness and poverty. And they realized that a lot of African-Americans were living under really bad circumstances. And the idea of temporary home shelters was a good idea, but it was a temporary fix. So as part of their systematic, a holistic problem solution, they removed the homes, the shelters away. It forced them to actually go to the root of the problem. So my question today is, yes, we love the foster care system, but is it sustainable? Is it holistic in its way it's solving our problems? Because as much as it is solving our problems, a lot of our adolescent kids are walking away feeling a bit damaged from out of it. How can we systematically solve these problems? And then the healthcare services. We want to make sure that the healthcare is available, it's accessible, and when it is, we want to utilize it. I am going to say, as African Americans, wherever we get the opportunity, let's be the service providers, let's be the psychiatrists, let's be the psychologists, let's be the counselors. Let's offer these and make it accessible. Let's get into the communities that are underprivileged, the privileges that everybody has kind of like forgotten about, so that we can start to help, we can have these discussions. And I know what I'm talking about right now is very high level. These are systematic things that need systemic solutions. But can we start to have, how do we make this available to us, the solutions available to us? How can we get the medical support that we need? How do we normalize that? How do we make sure that when actually the psychiatrists come into our communities, we actually utilize, we actually go and seek the help that we need? Just checking on the time. Do we have any comments right now? Or any questions at this point before I move on to the last part?
I don't see any in the Q&A, and we have about 20 minutes.
Okay, thanks a lot. So we should be working to eliminate the stigma associated with mental health. African Americans should have unlimited access to mental health, eating disorders, and substance abuse resources and care, regardless of their social and financial status. It starts from the bottom up, meaning that this is a grassroots issue. Additionally, there needs to be an increase in the number of African American mental health professionals and greater cultural competence in those currently in the field, and an increase in education in the faith communities about the role of the professional mental health treatments and how they can work together. So we kind of like summarizing now to say, yes, it's a bigger issue. We need to get to the grassroots. Some of it we'll be able to control. Some of this you'll be able to say, you know, tonight you can have dinner with your children and you can tell them what you've learned, or with your aunties, with your grandparents, and you can say, hey, let's have a discussion. But some of it is going to take longer. But the good thing is that we're starting to have the discussion. How do we normalize this? It is important to know that efforts towards social justice among the Black community will remain incomplete until mental health disparities among this group are addressed, and that seeking mental health treatment is a part of the overall health. The Black community has a long history of social change, and prioritizing mental health is not a sign of weakness, but an act of strength. So Naomi has just told us we've got about 20 minutes. I'd love to leave this time now to any input at all, to any questions. And I will answer as many questions as I can, but feel free to add also to some of the responses that I'm going to give. Let's make this a debate. What are you going to take? What are you going to apply? When is the conversation starting in your family, in your community, and in your workplace? What is the the responsibility that you're taking from this important discussion that we've just had?
Dr. Ritz, we do have a question in the chat from an attendee.
Yes.
The question is, how do you suggest attracting mental health providers to our area and in keeping them?
I think we have to make a business, we have to make a case for it. We have to say we need this. Go to the institutions that are around you and say, we need this. Can we have a clinic? Can we lobby this? Can you use the city of Tallahassee to do something? The cities that you have, can you make a case so that you're taking it at a local level and say, we need that? That's one way of doing it. Another way is to go to the private sector and make your case to say, as a private sector, as this big corporation, can you be a sponsor for a clinic, for our psychologist? Can you give us some resources? Right now, everybody's talking about inclusion and diversity and talking about, bringing races together and bringing in the bridges. These are all opportunities for the corporate world, for our local government to start working together. But I suggest that you formulate your ideas as a community and make your story strong to say, we need this. This is what we're experiencing. Show them the barriers, show them the risk factors, and say, hey, this is what we need. And then doctors themselves, I know that doctors want to do pro bono work, approach doctors, psychologists, and medical and say, hey, we keep them. Now, the latter part of your question is, how do we keep them? We keep them if we start using them. So if they're doing events, if they're doing summits in your local area, go in numbers, show interest, show that you want to be educated. Because if they keep pouring the resources and we are not tapping into the resources, they're going to move away. So again, we do that by having the conversations at our dining room tables and saying, you know what, there's a summit that's coming up in our community. How we have to go as a family. What questions should be answered? What questions should we ask? Okay, great question.
Another question that we have in the chat, Dr. Ritz, is they want to know, the attendee would like to know, what's the difference in depression and just being strong, overwhelmed, and needing a break?
I think for me, depression is when you are now in it and you can't, and it's been going on, it's prolonged, it's deeper, and it's deeper. Let me give you an example. In this pandemic, if you looked at it, most people fluctuated. One day, most probably, they were feeling like, oh, this, the world is on me. Unemployment, remote work, I really don't feel like it. But you know what? A week later, they're up and they're moving forward. But depression puts you down for a while, for a very, very long while. Doesn't make you feel good at all. You don't want to be with people. Fun activities that you used to love, you don't love them anymore. Nothing interests you, because I've watched I've watched a depressed person. You would think this is going to excite him or her. No, they don't. So when you're in that lump and you can see that you don't even want to do something, you don't want to carry on, that's a huge alarm. And then so you begin to isolate yourself. The things that you used to enjoy, you don't even want to. People kind of like irritate you. And maybe now you're beginning to think, why am I really here? Am I worth it? Am I really worth it? I'm not worth it. Then you know that we are now moving into depression if you're not already depressed.
Another question that we have is, these programs being presented to our school boards, government officials, etc., so they know the importance of mental health?
I couldn't answer that, and I'm not so sure if that question is being asked from a summit perspective or not. So I wouldn't know whether the same information here is going to be presented. But I would say this is a good way of starting to do that. These can be duplicated.
We have one last question on here. It looks like in the chat. Let's see. With significant disparities of African Americans faced with regard to social detriments of health, you would expect to see mental health diagnoses as much greater rates in the Black community. Yet, as you mentioned, rates of mental illness for Blacks are comparable to whites. What are your thoughts about this? And why is this?
I really didn't understand the question. Could you repeat it again, please, Kelly?
Yes, ma'am. The question is, with the significant disparities African Americans face with regard to social detriments of health or determinants of health, you would expect to see mental health diagnosis as much greater rates in the Black community, yet as you mentioned, rates of mental illness for Blacks are comparable to whites. What are your thoughts about why this is?
For me, again, it goes back to the research and our stigma. We are not exposing ourselves. We are not going for the medical help that we need. And sometimes when we go there, we are misdiagnosed. We don't trust the situation. And then, as I explained earlier on, some of our population is in jails and prisons. So we don't have a full picture of exactly what's going on, so to speak. So though we have it, though we understand it, but it's not as prevalent in the other ethnic groups or other races because they're more open to that. They trust the system more than we do. We are not. We are not. So this is why we're saying that there's a stigma around it. We are learning now. So I think the more we also make ourselves open to the studies and to the research, the more information we'll have. But at the same time, the system itself has to make us accessible so that we are accessible to the treatments, to the studies. So it's a way of developing and growing. As us, as Black people, are being open to it, the systems that have been put into place also have to open up so that they allow us to come in and then they can do their research that is really open. So it's a two-way thing that's going on.
Another question that we have in the chat is, so you have to have suicidal thoughts in order to be considered depressed?
No, not necessarily. No, not necessarily.
Okay.
But it can be one of the indicators. It can be one of the indicators.
We have another question that asks, do we need for first responders to identify and get help for mental health patients when they encounter?
I would say yes. In my mind, yes. As you can tell, the first responders, when we go, if you send a first responder who cannot tell the difference between mental health and other issues, that can be a problem. I'm for that. Go ahead and include that as part of the solution, because we're talking about systemic problems, right, that are persistent. So if we put them as part of our solution, that can begin to propose or present a holistic solution to the problem. I agree with that.
Dr. Ritz, one panelist has made a statement on here that says, the current climate provides an opportunity to address mental health without the stigma.
Is that a question or a comment?
That's a comment.
That's a comment. Yes. I don't know. I'm not so sure about the current environment. I don't know whether we are there yet. As an opinion, I'm thinking these discussions we are having will start to help us work around the stigma, will start to help us open ourselves to understanding that mental health is not a weakness, it's not a taboo, it's part of life. I don't know whether we are there yet.
Dr. Ritz, I have a question.
Yes.
Can non-Black people be advocates for Black mental health? And what is the best way to do that?
In my personal opinion, I believe yes, they can. I always believe that you don't have to be Black to help or to have a voice. One thing I'll say is that if you are like that, it means that you've got an understanding, you have read, you've educated yourself, you've spoken to the African Americans, you've empathized, you've put yourself in their shoes, and I truly believe that your voice would make a difference. I also believe that there's a place for you and the African American community to actually collaborate, work together, and make this voice a stronger voice. I believe that when we get there, when we work together like that, we start to come up with even holistic solutions. Because you're beginning to share your story, and I'm beginning to understand where you're coming from, how you see me, and how I see you. And then the solution that we are bound to bring together or to bring to the table is bound to be very holistic. Do we have other questions? Let
No,
me
ma'am.
ask. Good. Okay. So let me ask the participants one question. What is it? So you can type in and Kelly and Naomi can read before I hand over to Naomi and Kelly. Naomi and participants, attendees, what is the one thing that you've taken from here today that you are going to take into your home, into your community, into your workplace, that you are going to do away with the stigma, to be a part of the solution?
I have in the chat you're a strong person by admitting you need help. And one person is saying to be a part of the conversation moving forward. Another attendee is going to research therapist. And another one is going to try to identify those that need help.
Sure.
Another attendee says, I like the idea of supporting families of color to have a more even starting point to help realize the needs of all people.
Sure.
Another comment is continued advocacy for mental health awareness and mental health care availability. There are not enough affordable therapists available in this community. And one last attendee comment is to spread the word to family and friends and to local officials. We need all access to mental health resources.
Okay. Very good. Very good.
I have a comment,
Yes.
Dr. Ritz, quickly, to talk more about mental health to all of their contacts, including their family.
Yes. Thank you very much. Thank you. Beautiful input. Thank you very much for all those sound like great ideas. Let's go and be the change that we want to see, because we can. We have a voice. We've been educated. There's a lot of information. As you can see, there's a lot of data. This is not normally how I do my presentations. Normally, it's not packed with data like that, but I needed to do it that way so that you could see the kind of information that's out there. This is a place of need. We need to solve this. One place that I'm going to just say is, if you can find it in your hearts, if you know of ladies that are fostering children because they're helping so many children, though they're supporting these children, nobody's really supporting them emotionally and mentally. So find a way of just blessing them and showing your support. On that note, thank you very much, everybody, for being a part of this discussion. Naomi, thank you. Kelly, thank you very much. And thank you to the City of Tallahassee for having me. And thank you for participants for being a part. Over to you, Naomi and Kelly.
Thank you, Dr. Ritz, for this timely and relevant topic. In closing, we appreciate your time and truly value your input. So please complete the session survey, which will be emailed to you following the session. We urge you to help us make this bigger and better next year, and we can only do that with your input. Thank you, and I will have a slide that represents the upcoming sessions for this evening.
Dr. Ritz, thank you again for taking the time to answer these questions and for such a great presentation. We are so glad that you were able to join us.
Thank you very much, Naomi and Kelly. You ladies did so well. Well done. I'm glad we were a true partnership.